Dominique, and we'll be your nurse today. Can you tell me your name and date of birth?
I'm Maddi Turner, 11/23/2001.
Okay, awesome. Can you tell me what brought you in today?
So today, I wasn't gonna come in, but then I noticed, my urine was like reddish brown, and that's not normal, so I need to be seen. But like, it all started out with like kind of, like muscle soreness, like my thighs were really sore, and then it's like kind of more my lower back like area. It's just like, it's achy and tight. It's really uncomfortable, and I've been feeling a little feverish.
Okay.
And I mean, I've never really experienced these symptoms, but I just kind of get hot flashes and stuff, so it's just different. So I'm like, let's get seen, checked out.
I'm glad you did. Have you been working out a lot recently? That could have caused some of that soreness.
No, I've been so busy, like working on the ranch. Like I don't have time to work out.
No time
so
to work out,
and I no time to work out.
And you said you work on a ranch. Can you tell me a little bit more about that?
That's my whole life is just like our home and stuff like that. I mean, daily duties, take care of the horses, feed the cows, and all the good stuff. And I know it's been hot out lately though. This hot summer here in Arizona, like goodness, it is really hot. So it's a lot. It's a lot of manual labor, but otherwise.
Do you experience any nausea or vomiting while you're working? Or
here lately I've been getting like those hot flashes and feeling kind of feverish. Like I said, I didn't take my temperature, but I'm feeling feverish. I get a little nauseated when that kind of happens, but no vomiting or anything like that, no.
Okay, and how much water would you say you drink throughout the day?
When I'm thirsty, like sometimes when I get done with the job, I drink maybe a bottle.
Yeah.
But like probably definitely with this heat and everything, not as much as I should. So probably a little dehydrated.
Okay. Well, I'm going to let the doctor know about all this information, so probably collect a urine test and maybe run a couple others. Before I leave, I'm going to do a quick assessment and take your vitals just so I can report that to him.
Okay.
Could you rate your pain for me on a scale of 0 to 10?
It's probably about like a 5.
Okay.
Yeah.
Alright. So I took the patient's vitals, and I noticed that her skin was a little bit clammy, but when I took her blood pressure, it was 98/72, so that's a little bit low, so we're kind of concerned about that. And then her temperature was elevated to 100.4, so I'm going to report that to the doctor to see what he thinks.
Hello, my name's Ezri. I'm the technician that's helping out today. I just got done talking with your doctor and your nurse, and they sent me in here to take some tests for you. So they ordered a urine sample and a blood draw.
Okay, yeah. Why do they need my blood?
So they're gonna take your blood to measure the levels of creatinine in your blood, and that will let us know how your kidneys are functioning.
Okay.
So we're specifically gonna look to see if they're high or not, because
So
they're
definitely,
high.
so definitely because of that urine color, they want to check the kidneys.
Yes,
Okay.
yep. And so that's what this is gonna do. So I'm gonna go ahead and draw your blood first, and then I'm going to give you a cup for the urine sample. So just tell me your name and date of birth.
Maddi Turner, 11/23/2001.
Alright. Then I got your blood. Here's your cup.
Thank
to
you.
do your urine sample, and you'll just put it right there when you're done.
Oh, sounds good.
And I'll take it to the lab, and it'll be a little bit before somebody's back.
How long will it probably take for this to come back?
About an hour.
Okay, sounds
Alright.
good. Thank you.
No problem.
1 hour later. Knock knock. Hello. How are you doing today?
Oh, I'm here, thriving, surviving, but I'm here.
Okay, so I'm Dr. Reynolds. Just tell me a little bit about what's going on with you.
So kind of like I told the nurse, I started out feeling like this muscle soreness in my thighs, lower back, and then what really triggered everything, like when to come in, I was like, my urine was like a rusty color, like that reddish brown color, and I was like, that is not normal. So, and I've been feeling feverish, hot flashes type thing. I just don't feel, like normal. So I was like, maybe I should definitely get checked out.
Right. Well, glad you did when you did. So we got your lab results back, and your creatinine is elevated. And so based on that and based on your symptoms that you're having, we're going to diagnose you today with rhabdomyolysis.
Oh, and what is that exactly?
So it's where your muscle fibers break down and they release a product into like your urine. It's normally excreted through your urine.
Wow.
Yeah, so we're glad that we checked that, or we caught that early, so it's not too severe. We just need to get you hydrated with some fluids and hopefully flush it out. So we're gonna keep you here for about 24 hours, just admit you overnight, and make sure that we can get everything washed out, and hopefully your symptoms will disappear.
So you're gonna like admit me to the hospital, like?
Yes,
Oh, okay,
just for precautions.
Oh, okay.
But like I said,
that's fine. Get fixed up.
right. We're glad we caught it when we did though, because a lot of times people let it go on for too long and don't notice it, and it could cause you to have dialysis for your kidneys failing.
Oh
and,
dear,
yeah. So you
let's
caught
not
it.
do that. Let's.
Right.
Yeah.
So I'm just gonna let the nurse know what we got planned, and she'll be in with you.
Oh, okay, sounds good.
Got any questions?
No.
All right, just let us know if you need anything.
Thanks, Dr. Reynolds.
Thank you. Okay, so I just talked to the patient. We're gonna admit her just to keep an eye on her. We're gonna have her have IV fluids, LR bolus. I let her know about that. So if you just want to get that taken care of for us.
Okay, that would be perfect.
All right.
Thank you. We'll get that started.
Yep.
Hello.
Hi.
I know the doctor just came in, so I just wanted to come in and talk to you about the treatment. So we want to get you in a room. Yes, exactly. Fluids. Yeah, that's going to be a big part of it. So we're going to go ahead and get you in a room so that we can get that started. But I want to kind of educate you on what's going to be important going forward.
Okay.
Like we said, fluids are going to be essential, especially when you're working outside in the heat. You're going to make sure you stay hydrated.
Drink that water.
For sure. And then your diet, if you can try to increase the protein that you have and make sure it's kind of low cholesterol, so things like chicken and maybe even turkey would be kind of helpful.
Okay.
And then increasing your vitamin C will really help too.
Oh, okay.
Yeah.
Awesome.
Do you have any questions for me?
No, not really. Just get admitted, get treated, and get it all over with so I can get out of here, I guess.
Yeah, I like that plan. Well, let me know if you need anything. I'll be back in 30 minutes. Check on you.
Okay, thank you.
So with Rhabdo, we are going to focus on monitoring the muscle pain and the swelling and the bruising that she has, and especially with her fever, with her having a 100.4 fever and her low blood pressure, we are going to focus on monitoring that. And as a nursing diagnosis, we can focus on fluid volume deficit from her constant sweating from being out on the ranch, acute pain from her thigh pain, fatigue, and impaired urinary elimination. And for the outcomes, we can do within 24 hours of interventions, the patient will be able to achieve a normal fluid balance with absence of a fever. And to implement this, we will monitor the I's and O's and make sure that they are balanced. We will start IV therapy as we described earlier, and then we will monitor her electrolyte levels. And then for her pain, we're going to give her NSAIDs so that she can help get the pain relieved, and then we're going to do bed rest so that she can really focus on healing her muscles. And then we're going to monitor her vitals and especially her temperature since she did have that fever. And so we know that this is Rhabdo is cured whenever within the 24 hours of interventions the patient was able to achieve a normal fluid balance of equal input and output as well as normal vital signs, with the temperature being 96.8 to 99.5, the heart rate being 60 to 100, the respirations of 12 to 20, and the blood pressure of 100 to 139 systolic and 60 to 90 diastolic, and the O2 sats of 95 to 100.
I'm cured. I beat that Rhabdo.
Love that.